Hello, everyone. This is Abhishek Sapkoda with Group 19, and this is my presentation for the case study 2. My role will be as the Minister of Health. So I'll start with the case presentation that was given to us. Um, I'll have it here so that you can read it in case you haven't, but basically it describes how the coronavirus started from China in December 2019. And as it continually goes on, we see that the numbers have increased across all the countries as well as the increase in death toll. So first I'll start with what is the Ministry of Health and what does the Minister of Health do in case you guys aren't familiar with the role and its title. So its main responsibility is to address and advocate for, as well as ensure successful health policies. And the mission of a Ministry of Health is typically to contribute to the development of the country by achieving the highest attainable health status for people. And how it goes about doing this is from the following. So, as the Ministry of Health, we want to empower communities for health promotion. We want to improve health services in a given country or location. We want to strengthen stewardship management, and we also want to improve management of human resources. And how the Ministry of Health interacts with the other health roles and other roles in general. So first, the typical framework is the government and legislative body. They are the ones that create the laws and policies, and it's up to the Ministry of Health to adopt and implement those policies. But we're also involved in formulating the health policies and can advocate for them as well. We also will provide direction and monitor, as well as evaluate for healthcare delivery and the different delivery systems. So now that we have a better idea what the Ministry of Health does, as for how does this role apply to COVID and what are some of the challenges that are involved when responding to this is described on this page. So COVID-19 is now classified as a worldwide pandemic. It's seen throughout the country as well as almost every continent. And it's spread from person to person via respiratory droplets. So that means it's easily infectious and requires that precautions be made so that the number of cases don't increase. Also, along with the lines of the spread, people can be asymptomatic and still be infectious. So those people are unaware. They're probably wanting to return to normal and not and go about their normal day, but that needs to be addressed as well so that they don't accidentally spread the virus to other people. So in addition to all that, we have hospitals being risk of overrun, depending on what region the hospital is in and how bad of a spread that the coronavirus has in that area. And then when you have those hospitals being overrun, you also have healthcare workers fatigue. So for this, effective management and leadership is vital. And now we also have vaccines that are available. So even though we have the vaccines, the next step would then to be how to go about distributing them so in a way that is effective and efficient and that can give the most amount of people covered. So with all those questions and things to think about, now we can ask how does the Ministry of Health should respond to all this? So as is the role as Ministry of Health, I have these prevention and strategies listed. So first, I'll talk about the public interventions, and the first one would have to be in education, and this applies to the general public. So education is probably one of the most important ones because uh, as our role as Ministry of Health, it's also our job to keep the general public informed with the most up-to-date knowledge so that they can go about taking the necessary precautions. So we want to educate the public on transmission, as well as high risk groups, so that those who are vulnerable parts of the population can also take extra precautions. We also want to educate the public on protective measures, and then we have the two protective measures listed here. So first is mask wearing. We our our proposed response for mask wearing would be we'll work with businesses to require that they enforce mask wearing when dealing with customers. And we also want to encourage public use, regular use of wearing masks. Another proposed strategy we have is social distancing. So in this part, we want to push the government to close most of the non-essential indoor spaces. So this includes businesses, restaurants, gyms, and other like what's deemed as non-essential indoor spaces, just so that there's less spread of the virus. And whenever we can, we want to encourage the public to stay at home, and I think this goes with education as well to ensure public compliance. So another strategy we have is testing and how to address testing. So as the Ministry of Health, we want to promote the accessibility and widespread testing centers for the public. We want to encourage people to have early and frequent testing whenever they can, and that these centers should be accessible and easy and widespread for the public. We also want to have regular screening and testing for workers who are labeled as increased risk of exposures. And by that, we mean primarily healthcare workers and first responders, because they're the most in line to be at risk for coronavirus. And another strategy we have that involves testing is working with stakeholders in airline industries and this is to require a negative test results in order for passengers to fly. We think that this would be effective in reducing the spread of coronavirus. So another strategy as a Ministry of Health we want to promote is the contact tracing. And what this means is basically identifying and informing those people who may have been infected from someone who has a confirmed diagnosis. We want to work with businesses for them to follow contact tracing protocols whenever they have people or customers in. And we also want to work with the government as well as state and local health officials to ensure mandatory quarantine on all public confirmed cases. And we also will work on surveillance of new cases as well. And then the last strategy we have is addressing vaccination. And with this, as the Ministry of Health, we want to partner with local health officials and local departments in order to coordinate effective distribution methods. So down here is a framework that I got from the National Academy of Science, Engineering, and Medicine. This is the framework that they came up with, and the one that I would recommend for us to use. It's split into 3 phases that will eventually progress as more vaccines are becoming available, as well as the COVID numbers. So we have like the first phase, which is labeled the jumpstart phase or the jump phase. And this is basically the people that we want to get priority line for vaccinations first. And this phase 1 is split into 2 phases, 1A and 1B. So in phase A1, we want to make sure that the healthcare workers and first responders get the vaccine. And then later, when more vaccines are available, we can move on to phase 1B, which will cover older adults. And that's considered anyone over 65, as well as people with comorbid medical conditions that are deemed significantly higher risk for COVID. So after phase 1, we, we can move on to phase 2, which will include teachers and other workers who are in high to moderate risk work settings, people of ages with comorbid medical conditions that are labeled as moderately high risk. And then after that, we have phase 3, which will cover pretty much the rest of the population, so including the younger adults and children. These are my references, and that's my presentation. Thank you.